it's always a pleasure being with in the presence of my. I don't want to say big brother, like my brother.
Why are you looking at there? Look at me.
Look at you.
Look at me. Look at me. Look at me. I mean, are you happy to see the camera or me?
It's just awkward if I look at you.
Oh, you look at me.
What's up, bro?
Oh, you're happy to see me. There you go.
One of the kindest souls,
Thank you, my
brother.
brother.
Honestly, like just you being in my presence just lights up the room. Very humble, and for me, that's the most amazing and most respect I have for someone is not just fame, not just whatever type of success, you know, just being the same person since 20 years ago. You know, so
Vice versa, my brother.
thank you.
We go way back with our history. Number one, so never forget where you come from, and that's important. So no matter where you're from, who you are, it don't matter. So, and that's why I respect you so much. And you came up from nothing, and now you're doing such big things, and you know, and actually you're pretty good what you do.
Not too bad.
You know,
Yeah.
you adjust. I mean, every time you adjust, I can walk for a week.
So they don't-
But overall, it's good. You know,
So
that's
they
a
don't
joke.
come for just the socks, huh?
No, brother. I mean, your socks, it throws me off every time. You know, I was in London, so I took a picture. I don't know if I
You
sent
sent
it to you. It says happy No, something sucks, some sort of stuff. But I didn't get your socks. Next time I will.
Bro, I have drawers and drawers, but yeah, the ones I get.
It's good, brother. I mean, listen, first thing first, with your this podcast and with your videos and everything else, people need to know how generous soul you are. And I'm not just here just jerking you off. First of all, you're just a straight shooter. You've been great and you're doing a good job. Like, you know your shit. So meaning of you went really deep down and find out what and how we do it. It's not just business. You're working with human body and bones. And guess what? I broke every bone in my body. If you don't know how to adjust it, I'm not coming. I love you, but I'm not coming. But you do. You're f***ing doing a great job. I'm serious.
I appreciate
So I can't wait to adjust me today.
I got you. We're gonna do something. Well,
Not, are you sticking
yeah,
the balloon?
I thought I was gonna be the first one, but
No.
Knowing how
I'm not virgin, bro.
Yeah,
Sorry.
So knowing how you know our Dr. Del Toro, we were in Alaska in July.
Yeah.
We even FaceTimed you. I should have figured out that you've had a balloon sticking up
So
your muscle.
have you done it?
Yeah.
For yourself?
Yes.
So like how your brain like starts, you know,
Well,
it feels like,
it's joints,
bro,
but yeah,
it works for me
something
and
lights
it's
up,
good.
Jay. It's
I mean,
amazing.
I even broke my nose,
Yeah.
so I always have some sort of
100.
problem. But this balloon thing, I think it's not only for this,
No.
right? It's also like opens
It's
up.
a lot of
so
stuff.
you know
going
better. Tell
But
me.
most patients that come in is to fix deviated septums and breathing issues.
I do highly recommend
Yeah,
the balloon. I mean, your
Yeah.
butt adjustment with Dr. Gureghian for sure. You know.
It's definitely intense, but I know I've broken my nose a few times playing
Sure.
soccer, but never could breathe out of my right side of the nose. But like I was so scared.
I still can't.
Yeah,
So.
but I actually had a deviated septum surgery, and it didn't even do anything. Like to the point where the doctor is sticking the camera in this one. He's like, bro, I can't even go through.
Yeah.
So you need it, but it didn't work. And then CFR actually did so much more benefit than the surgery did.
I mean, the way Dr. Del Toro explained, you know, how much like oxygen you can get, and it's the overall, it just good. It felt good,
So
you know.
the way we adjust, just your standard chiropractic, we only are able to activate or work on 20% of the nervous system,
Correct.
right? So obviously your brain stem, guys, is the remaining 80%. So with CFR, we're able to target that 80%. So even though it's mostly for deviated septums, there's a lot more deeper and more difficult diagnoses type patients we're gonna see.
I mean, it's all connected.
Neurological,
so,
right? We have like MS patients who benefit highly from it. 100% of the time it cures like trigeminal neuralgia. So when you get the trigeminal nerve pain up here, you know, so stuff like that.
Well, what's your favorite when you adjust legs, ears? Remember how you crack
Yeah,
the ear?
yeah, I'm gonna do that.
Or
today.
I know, I got it. But what's your
My
favorite?
favorite adjustment is the neck.
Neck, right?
Just I'm confident in my ability, and I know the way I approach it is more specific. It may seem aggressive, but I know the type of thrust I deliver, it's gonna unleash a lot more endorphins, which is what your hormone releases when you get that pop. So the experience is definitely different from your ordinary chiropractor, which I personally don't like it when they just turn the neck, rotate and do that, because that's not an adjustment. So with me, I do more lateral flexion and just the patient's reaction, because first off, it's close to the ear, so it's much louder, right? And you get that rush of oxygen to the brain. And just like you do
how many people do you adjust today, let's say?
I've decreased it significantly lately because I have 4 doctors working with me at the clinic. But during COVID, myself 60 to 80, and it's not just adjusting.
Well, listen, that's a significant physical work for you. So it means like literally you are adjusting 250-pound guys or girls,
more,
doesn't matter,
less or more.
And then it goes up and down. So who is adjusting you?
I have 8 doctors working on me, and it's no secret that I've been dealing with my own injuries these past few years, and it did happen from adjusting too much, not having the...
So who do you trust? You said you have 4 doctors. You can't be honest.
All of them.
No. There's one you have to say you like.
My neck, I'm going to be honest. No one adjusts. I'm the size of herniations in my neck, it's contraindicated to get an adjustment. But we do the decompression and stuff like that. Cool. So any of the doctors could stretch it. But we're trying to accommodate with this expansion in every way possible. So you know how I use the strap, right? So imagine they're just so long I could do it, right? After like 2 to 5 minutes, your muscles are going to give out. So we actually have purchased decompression tables where we strap the neck, and it has sensors. We use the patient's body weight. 15 to 30 minutes is just pumping. And it depends on the program. But usually if you have a 6 millimeter disc herniation or higher, even the surgeons I refer to, they don't recommend actual adjusting. They do approve and like the decompression that we do, and I agree with them, even though I'm very confident in my skills where I could. But again, if my only intention is to improve a patient, but there is a 1% chance I may flare them up or it may make them worse.
But in what sense you would recommend or not recommend your patients, hey, you have stiff neck or something, like how deep, like come in with your MRI before I can adjust you? Because some people get adjusted like, oh, I have a headache for a week. It happens, right? So it works for me with martial arts background and everything, but you tell me, like how confident they should be,
They should be confident, and unfortunately though, not every chiropractor is the same or built the same. Just like every professional, any industry, there's good, bad, and the thing I wish we could work on is making the chiropractic community at least similar in the type of techniques. And
how many times would you recommend to get adjustments? A month? It varies.
It's a complicated question because it depends on what state of wellness they're in, right? Their age, and what their patient's goal is. But if it's a wellness, ideally I want you to be in a place where once every 4 to 6 weeks, let's say. And that's more for maintenance care. Just like you see a dentist, right? Your spine. And I saw a post which I think is amazing. If your spine was on your face, more people would invest in it. You don't see it, and even us, as men or whatever, it doesn't matter. But we're so busy with our life. Oh, the pain will go away. I'll get to it next week. And until you're at that chronic, severe stage, then you go, and it takes longer. It's going to be more painful, more visits. So as soon as you feel the symptoms, just come in, just a quick alignment even. I have some patients just on their lunch break want to come in. Established patients though, obviously you have to take vitals, your thorough history, and make sure, because there are patients that have contraindications, obviously with rheumatoid arthritis, some other arthritic conditions. We can't adjust the neck, God forbid, but there's laxity in the tissues or ligaments, which can make it unstable.
How far we go back, and remember, like I always come and go get
Yeah.
adjusted, right? So, and I believe in it, and I feel great. So even though it's just like I don't know, when you go get your car alignment, it's the same thing for us, right?
Yeah.
So one leg and a hip and this and that. So a lot of people would come up and say, "Oh, your joints gets weak," and every time you get adjusted. So do you, as a doctor, what would be your answer on that? Your
The joints get weak.
Yeah, well, every time you adjust, is that such thing like that? You know?
If you're talking about, when your parents say don't crack your knuckles,
Sure.
In that sense, yes, it
No,
can.
specifically going to the doctor and getting adjusted.
Chiropractic, if anything, I think it will allow for optimal or longevity. Okay, so if something isn't moving properly, eventually your body's going to start creating soft tissue around the muscles or joints or degeneration to help stabilize the joint. But with proper alignments and self-care stretches, you're going to keep that joint moving optimally and healthy and have no need to grow scar tissue.
I think this is a very important answer. Yeah,
but
thank you.
Yes,
that's
even
really
though when they crack knuckles like this, you are putting uneven pressure on the joint. So think of it like a rubber band. So eventually you stretch a rubber band enough, it's going to get brittle and break.
Of course.
So even I tell patients, if you're going to crack it, don't do it like this, okay? Just pull it in symmetrically. That's it. So that's why when I adjust in my videos, it's just because
just
now
straight.
I have even pressure on both sides,
Gotcha.
which will prevent instability or too much laxity in the tissues.
Does it go same with the girls I mean, guy and men? I mean, females, males, or it doesn't matter? Yeah, as far as adjustments.
No, I mean, obviously depending on the type of adjustment.
Condition, yeah.
Certain, let's say with female patients, there is a different approach I do take. Obviously, I've taken count breast tissue and whatnot. So when I'm doing like a thoracic adjustment, I will, prior to doing so, kind of go through them pressure or movement and ask them if that's comfortable or does that hurt your breast tissue. Some patients say, yeah, it hurts, and then I have a different placement for the hands. Because last thing you want to do is push down, it hurt, they guard, and when you thrust, when they're tight, you're going to hurt them more straining. So
it goes the same, like 4 to 6 weeks, females and males, and
and if someone's training for a UFC fight, I may recommend more frequent.
Absolutely.
You know how hard.
Been there, done that.
Right?
I mean, you go through injuries.
And unfortunately, the first time I met you personally was during your elbow injury.
Yeah, when I broke it. Yeah.
At my mentor's clinic. So
that's right.
Big Sarkis. Shout out to you, big brother.
For sure, my bro.
Love him. And it's a great soul. Anyways, training as hard as you do, you're gonna injure yourself.
Yeah, so I mean, we'll get
your diet is important as well as self-care. So you got to make sure everything's.
I just want to make sure people know how important the chiropractor is, for your joints, and it's so important. I see people walk kind of funny and they're crooked, and now they have hips and this. Of course, the weight, belly, all that, it adds up. I get it, but at the same time, adjustment is very important.
Yes, it is. And the thing with me is, I'm always. They said I can't check out a woman the same way ever again because. Let's say you find an attractive female or person, whatever it is, walking down the street, and instead of like checking out and admiring, you're like, okay, they have a short accentuated hyperlordosis. So
that's why every time I walk out, the girls come out from your office, I admire, and I'm like, that looks better than 10 minutes ago before a doctor adjusted. Because it's something you did. You pulled their leg, man. It's right alignment right there.
Like it's so natural. When I see someone, I start leveling their shoulders, and like most people who don't know what
it's like a shoemaker. Hey, he has a good shoe.
You know what? I do want to go get adjusted, but I don't know if you want to tell everybody my nickname or story. How
I would love. I'll tell you your nickname. You can tell the story. So as you know, Raffi, Dr. Raffi. For me, Raffi has been Roofy. So, and then even until today, I text you like, hey, Roofy, and we just crack up. So You go ahead, tell the story. I think it's
so back when you were in the UFC days, and you know it's being in boxing and whatnot. There's always those boxing gloves that you have like your gym's name or your logo. And since we were treating you at Cholakin's, you wanted to gift everybody their own personalized with their name and last name with
and my spelling UFC is really good, you know.
So you know. Again, I don't know if I could blame you for it or it was an error on was it you?
You can blame me, actually.
So my name is spelled RAFFI, and then he gave me the gift, and naturally I'm looking at the name and it's spelled RUFFI, and my face just went down. And then, you know, I thought, I showed Roman, and I thought he's gonna be like sincere. Oh man, I'm so sorry. Hey Roman, you spelled my name wrong. It says Roofy. And of course, being the big brother, you just start cracking up and mocking me and like screaming it loud, so the whole clinic heard. And since then, my name's stuck as Roofy. And
I still love you, my brother. This is it.
But it's one of my favorite memories. That's kind of how it started. You suck, man.
Still my spelling sucks, so no matter what.
So yeah, as long as people don't know me as Dr. Roofy, because that might mean something else. I'm very proud of you. I see you doing big things, and you know you're one of the few people like I want to reach more success than myself. You know, because
my success is your success, and it's vice versa, and it's always. I'm proud, and now I do films and TV. I work in Hollywood. I'm blessed, and I always say I have great friends. The reason it happened for me, or it's happening for me, because of these people surrounded me. They pushed me, and they believed in me. And I always say, people will ask me, God is my witness, and God is my agent and my manager, and for Jesus' name. And I always mention that, and I'm into that.
You're pretty good, bro. I'm not gonna lie, man. So it's like, and I didn't know like you were in these big pictures or shows, because I'll be watching, and their shows maybe like I think Sons of Anarchy, I remember, and I think it was Castle or
that did that too.
Probably. And I'm like, you know, every time I'm just sitting there drinking or eating my popcorn or something, it's Roman. Babe, it's Roman. It's my brother.
The only thing you can always bet with your friends or family, they'll kill me in the show, because I'm always the villain, and it's called typecasting.
Not in the promise.
Not in the promise, and there's other. So I'm moving up a little bit. So thank God. Next, I'm with.
I'm still trying to get you to get me contracted.
We will.
Come as
we
the
will, my brother.
Chiropractor.
You will come in, maybe, just all the actors.
If you ever need a role for a good-looking young doctor who has skills to crack necks, or like.
The contract will be roofy, though.
Oh. I walked into that one.
Okay.
I almost finished the podcast without mentioning this story, but you know, everybody deserves to know.
Dr. Roofy comes in. He's gonna Roofy? Okay, great. That sounds good. Let's do it.
He has no idea. I'm about to adjust his neck, and I'm gonna stick a balloon in your nose.
Let's do it, man. Let's go get it done.
So I'm gonna have the last laugh. All right,
let's do it, brother.
Stay adjusted.
Thank you.
Let's unleash the Kraken, baby.
Yes, sir.